Dr. Cassi from NAVC's Vetfolio and the host of Vet2Vet. Starting the conversation about parasite protection early can go a long way in making sure that our feline patients are protected, especially when it comes to diseases caused by fleas, ticks, and other parasites. Talking to cat owners about staying ahead of the problem is so important. Even with indoor cats, they need protection as well. Dr. Destiny Coleman joins us today to help us get ready for those conversations. Dr. Coleman is a graduate of UPenn Veterinary School and has a passion for preventative medicine for dogs and cats. She now enjoys educating in her role as a professional services veterinarian with Boehringer Ingelheim. Dr. Coleman, thank you so much for joining me.
Hey, good morning, Dr. Cassi. I'm so glad to be here with you guys today to talk about these parasites that really plague our cats. I think they're really underappreciated, so I'm excited to shed a little light on that.
I could not agree more. And these can be tough conversations. So I'm really excited to have you here and hear your input.
Yeah, definitely.
Well, so fleas and conditions caused by fleas are commonly treated in veterinary practices. What do you feel like are some of the most common misunderstandings or misperceptions about flea infestations in cats?
Yeah, so just right off the bat, I feel like fleas are sort of the forgotten parasite, almost like they're old news. We talk so much about ticks and tick-borne diseases now that I think we really underappreciate the flea situation still across the United States. They're so common, but can be treated as an innocent threat, which I really think is a mistake. We know fleas can cause many issues such as anemia, flea allergy, dermatitis, and transmit parasites like the flea tapeworm. Seeing a cat with fleas is common, but vets can also see flea-associated or flea-related conditions without any visible fleas due to the cat's natural grooming behaviors where they really can remove a lot of those. So since we can have a flea-associated health problem without obvious fleas, that can really make the education and communication with the client that much more challenging. I like to encourage flea protection for all cats since we cannot keep fleas outside. And so many people nowadays do really fun things with their cats and take them outside, whether it's on a leash or a catio or something like that too, which is great, but we don't always uncover that during our history and our exams with our cats. So we want to make sure that everybody has some sort of protection. Sometimes also it's not up to the owner if the cat stays inside and they might sneak out. There's one statistic that has always reinforced this idea for me. There's a published study where 41% of lost cats were identified by their owners as strictly indoors and typically not allowed outside. So if we think about all of those found cats, 41% of them were not supposed to be outside. That's a really big percentage. And I think that's probably a surprise to most cat owners and maybe even a surprise to vets.
Wow. Yeah, I would say so. That really does surprise me. I was just talking with a cat owner yesterday, and it made me laugh. We were joking about how cats can just show up and move in, and we're like, okay, what kind of food do you want? And this particular cat, she described him as not wanting to stay indoors, and he had this behavior he would do to tell her he was ready to go outside. And I'm like, yeah, and they move in, we feed them, and they don't even stay there and hang out with us. They're like, okay, this is enough. I'm going to go outside now.
Yeah, I like to call that the cat distribution system, and the distribution system picks you.
Yes, yes. I love the cat distribution system. It is forever entertaining, and then these cats end up with great families.
Definitely. I so far have not been selected by the cat distribution system, and I think my dogs might be part of the problem there.
Yes, I'm in the same boat. I can relate. So I mostly, kind of vicariously observe the cat distribution system.
Yeah.
But anyway, I digress here. And I really do agree that fleas are a very important parasite. I myself have probably been guilty about focusing a little bit more on ticks here lately, but I've seen my fair share of diseases related to fleas in cats. However, like you mentioned, it can be hard to have those conversations, especially if we're not finding a lot of flea dirt, a lot of evidence of the fleas physically being on the cat. So let's talk about options for flea protection. Can you tell us about NexGard combo in cats?
Boehringer Ingelheim hasn't forgotten about the fleas. We know they're not just a nuisance, but also a threat to health. NexGard Combo has azafoxylaner as the active isoxazoline ingredient, which has excellent flea efficacy, as you'd expect with an isoxazoline. This ingredient is simply the active portion of afoxylaner, which is the active ingredient in NexGard for dogs that many people will be familiar with. That means that Boehringer simply separated the active and inactive halves in an effort to reduce the total volume needed for a topical solution for NexGard Combo to accommodate all of the active ingredients. What I also would like to share is that Boehringer has a great flea guarantee for their parasiticide brands that's very comprehensive, and depending on the case and the information provided, it may even go as far as sending extermination services to the pet owner's home, which I think is really above and beyond to make sure that we're tackling the problem for these pet owners.
Wow, that really seems like a focus on just the overall well-being of these cats to go to that length to make sure that they're protected.
Yeah, I really love the satisfaction guarantees that Boehringer offers across the entire portfolio. But I think for fleas, that is really reinforcing that we're here and we have your back. And it really helps for the veterinarians to be able to encourage the use of these products and say, hey, you've got a backup plan as well. Not that hopefully they would need it.
I would imagine that there's probably an assumption that this is going to work really well, and that, you know, pet owners for the most part probably aren't going to need it, which is, yeah, it gives you a real degree of confidence.
Yeah, definitely. I think more than anything, it helps have the conversation that every pet in the household needs to be on a preventative to go ahead and protect against fleas and make sure that we're kind of checking all of the boxes. And even if you do all of that, things can happen. Nature's wild. And so Boehringer will have your back and we'll go ahead and utilize that satisfaction guarantee.
Very cool. Very cool. And I want to circle back around to tapeworms real quick. We mentioned that a little bit in the beginning. I have a little bit of a confession that I kind of appreciate tapeworms as a parasite. Just because they're a good conversation starter. These animals tend to, you know, really not be too much worse for the wear for having tapeworms, but the owners can see them and they get really worried and they rush their cats in and they say, oh my gosh, my cat has worms. And it's just a great conversation starter. It's a great opportunity to talk about the importance of parasite control and where these tapeworms are coming from, and especially in these cats where we're not seeing a lot of fleas and flea dirt because they are good at grooming. All of a sudden we have an angle to talk to these owners and really make an impact. So what do you feel that we as veterinarians need to consider when we're thinking about tapeworms? Because in the absence of the owners seeing them, they're not always the easiest parasites to track down.
Yeah, so I usually start with the idea that, as with most other things, cats are not dogs. This is true for tapeworm risk as well. Cats have a higher prevalence of tapeworm infection compared to dogs. When I think about that, the first thing that comes to mind is a complete difference in typical cat behaviors compared to dogs. First of all, cat tongues are basically flea combs, and they are much more avid groomers than dogs, spending 30 to 50% of their day grooming very thoroughly. So the likelihood of them picking up and ingesting a flea to complete that life cycle for Diploidium caninum and infect themselves should be higher than in dogs. The data out there supports this idea that with cats having nearly double the tapeworm incidence as dogs, there are some studies that report 5 to 15% of pet cats being positive and over 50% of cats in animal shelters infected with tapeworms. For me, this reinforces the need for tapeworm treatment to be included in a monthly combination product for my feline patients. I think it is something that we need to address and address more regularly.
Yeah, it sounds like it. 50%. I never would have, if you were like, how many cats do you think, you know, are, have tapeworms? That number would not be in my mind.
Yeah, it's really staggering when we start to look at surveys and some of the newer test results for tapeworms, because typically on O&P tests, right, that we might do in our clinic or even send off to a reference lab for a traditional test, we're just not getting those results. So if we dig a little deeper into the data that's available, this is what we're going to find.
Absolutely. And I love that you brought up the diagnostics because I think that's part of the struggle is we don't always pick them up on our kind of more traditional diagnostics that we're used to for examining stool. But I understand that there are some newer diagnostics that'll help us pick them up a little bit more readily, kind of like you're talking about here. Can you talk to us about these newer diagnostics and maybe more so how it'll influence client communication around tapeworms and flea protection?
Yeah, definitely. We are greatly improving the understanding of true prevalence of tapeworms with these newer diagnostics. Traditionally, they're very challenging to diagnose on a fecal float because, well, they don't tend to float because they're too heavy. But there are newer tests from both IDEXX and Antech looking at PCR and antigens that are giving us significantly higher prevalence rates than the traditional testing methods have delivered so far. While we don't see high morbidity from tapeworms, this particular parasite can be devastating for the human-animal bond due to what I call the yuck factor of proglottids and the tendency for cats to go anywhere in the home, including your sacred places, maybe like your pillows, which totally grosses me out when I actually think about it. If we are identifying more tapeworm infections, we are going to be having a lot more conversations about parasites and fleas, and hopefully over time, we can increase the poor compliance that we already have for parasite protection for our feline patients just by opening that door to having that conversation. And tapeworm might be our gateway worm.
Our gateway worm. I love it. I love it. Thank you, tapeworms. Because yes, you paint a really powerful picture there about cats going everywhere on our pillows. I'm also thinking like on the kitchen counter. So yeah, I think this really opens the door to have these conversations.
Yeah, I think once we start to point that out and think about where the cat can be or will be, it really opens your eyes to the things that you don't want the cat to have, like parasites.
Yeah, absolutely. Absolutely. Well, let's pivot here to ticks as another parasite that's important. And a lot of times we can get people on board with the fact that fleas are out there and their cats may be susceptible to flea infestations as we have these conversations. But then there's the cats don't get ticks, or I've never seen a tick on my cat. And kind of like we've mentioned here, I mean, cats are really good groomers, and there might be parasites that we're missing. Can you help us address some of the myths that we might hear associated with ticks and cats?
Yeah, this is such a tricky thing because even I agree. I don't often see ticks on cats when they come into practice, but we know that they're out there and we know that they do bite cats. Again, the grooming behavior can mask the problem in some cases, but the data does tell us that ticks bite cats and they can transmit disease when they bite them too. There are over 15 species of ticks identified that have been removed from cats in the United States. There are the most common ticks, of course, are going to be your black-legged tick, your Lone Star tick, and your American dog tick that are going to want to feed on your feline patients. Even indoor cats are at risk for ticks because they can hitchhike in on your clothes, or other pets like indoor and outdoor cats, or of course your dogs. Never mind the cats who decide to be adventurous and bolt out the door one day. There is no cat with zero risk of tick exposure because of these risk factors. So similar to our conversation about dogs, I would just remind everyone that there is no tick-free time of year. They are active if the temperature goes above freezing for the day, and they are going to be looking for something to feed on, which is going to include your cats. So I use the same message. They may not need tick protection every day of the year, but certainly our feline patients need tick protection every month of the year.
I think that's such a powerful message. And I love that in many of our conversations about ticks, more recently, at least from what I've heard, that emphasis on they are active as long as it's above freezing, because no matter where you are, especially here in Florida, not a whole lot of days where it stays below freezing the whole day. That there is activity all year round. And I think that's such a good way to put it, that even if it's not every day, it's certainly every month.
Yeah, definitely. And I think trying to reinforce that. And also, it's just so much easier to maintain a habit on a monthly basis, like applying your flea and tick product versus saying, oh, I'm going to remember to restart this in March or April or the spring, right? Because we all know how life happens.
Absolutely. You just kind of look at the calendar one day and how is it July?
And here we are.
And here we are. um, well, let's talk heartworm disease. This is a challenge for me, if I'm being honest. I mean, just heartworm disease in cats seems more complicated than it is in dogs. So, what would you say are some of the important parts we need to consider when we're thinking about heartworm disease in cats?
Yeah, I'm glad we get to talk about heartworm disease in cats. I feel really strongly about this. So, the first thing that I want to say is that it's far more prevalent than most vet professionals think. And that's a really big deal because I think we often, as a profession, gloss right over it in our cat and kitten exams. Anywhere you'd expect to find a heartworm positive dog, you sure could find a heartworm positive cat. And they also should be protected from this disease. One of our first mistakes is that we aren't even testing for it routinely. If we don't check for it, we obviously won't find it. And we sort of have this false hope that it's not there and it's not a problem. Being from the Northeast, this is a similar conversation to when we started talking about Lyme disease in dogs. Both of these diseases can be silent in many patients until it's not anymore, but we won't know the true risk and prevalence until we start routinely screening for it. The largest antibody-based serosurvey of feline heartworm in apparently healthy cat population was just published in 2023. And the results of this survey really surprised me. I've always felt strongly about feline heartworm disease, but this helped reinforce it and maybe put up my flags even more. So the nationwide prevalence came in at 3.5%, indicating that the true prevalence for cats infected with Dirofilaria immitis in the United States may be significantly underestimated. When we look at the data on Cassi, which I think is an excellent resource for prevalence of heartworm and vector-borne diseases, the data is coming in from testing at the clinic level. If you look at the national prevalence reported for all of 2023, it's only 0.79%. The number of dogs tested and reported on Cassi for heartworm disease is 19 million. Do you want to guess how many cats were tested?
I would imagine it is significantly less than that.
Yeah, so less than 250,000 cats were tested for heartworm disease. So these are clinics that are using the right testing and have the right relationships that their data is being reported to this Cassi site. And when we look at those clinics, 19 million dogs, we think it's really important in them, and then less than 250,000 cats. We are not doing our due diligence for the cats out there, and that's really a shame. I really encourage people to start looking further into doing heartworm testing. And if we're not going to test, we at least need to protect against it.
And that's a really powerful picture that you painted when you compared it to Lyme disease, because of how these diseases can kind of be silent until they cause a problem. And thinking of clinical signs of heartworm disease in cats, also much different from dogs. I understand one of the more common clinical signs of heartworm disease in cats is just sudden death. So my first question is that correct? And certainly if it is, it seems like this is a big deal, kind of like you're saying here, if this is very prevalent and it can be very severe and it might be silent until all of a sudden it's a problem. Something we should definitely be talking to pet owners about. But that can be a hard conversation when I'm thinking of talking to a pet owner of like the clinical sign is sudden death.
Yeah, but I think that that's what's really important, right? So heartworm disease may be unrecognized for months or years in a cat or dog. And sadly, one of the first clinical signs can be sudden death. So commonly cats will develop HARD or heartworm associated respiratory disease when the heartworms are causing damage in the respiratory tract with or without symptoms. And once symptoms do appear, it can be tricky to figure out that it is heartworm disease rather than a primary lung issue. But more importantly is if you have a cat that experiences sudden death, right? Imagine telling an owner, hey, I'm so sorry that your cat died. We've discovered that the cause of death or the sudden death is feline heartworm disease. And we've not taken the opportunity to at least educate and offer them protection against heartworm disease. To me, that's a position that I don't want to be in. I don't want my fellow colleagues to be in. I want to make sure that we are educating and letting these clients know This is a preventable disease that is difficult to test for, has no treatment options, with a common side effect of sudden death. So how could we not be highly recommending heartworm disease prevention for every cat out there? If we aren't testing, that's one thing, since we know the tests do have limitations and can be a little bit tricky, but we are remiss if we are not educating and recommending protection for the cats, in my opinion.
Gosh, and that just, when you said that, it just like hurt my heart. I got a pit in my stomach where picturing this cat experiencing sudden death and finding out it was a preventable disease, and looking back through those records and feeling like, man, what would have happened if we would have had these conversations differently? Like that's a hard thing to carry.
Yeah, and so that's why I really am excited that we get to talk about heartworm disease, and I hope that people who get to watch this will appreciate some of the statistics, because I don't think that the statistics are widely understood, and the true prevalence of heartworm disease in cats is really underappreciated and underestimated. If diabetes, for example, had a 3.5% prevalence rate in cats, we'd be starting to talk to pet owners about it as kittens and really focusing on nutrition and lifestyle, right? But we're not doing the same thing for heartworm disease, I just don't think. And I really hope that just knowing some newer statistics and some improved prevalence rates, maybe it'll encourage a little bit more conversation for our cat owners.
Absolutely. And really drive home the point to all of us as veterinary professionals of how important it is to have these conversations. And when we believe in the importance of the conversation, then it's much easier to relay that to the pet owner in a way where they feel that urgency and that importance as well.
Yeah, and that's part of my goal here, or my goal when I work in the field or when I educate representatives of Boehringer Ingelheim, is just awareness and education, because I think if we did truly understand heartworm disease in cats from beginning to end and kind of uncloaked the mystery of it, I think that can go a really long way for us.
Absolutely. Absolutely. And speaking of these kind of what can be silent parasites, roundworms and hookworms. For me, with roundworms and hookworms, I feel like I see these infestations in kittens, but then it sort of drops off in adult cats. And I'm wondering if part of that is because it can be hard to convince owners to bring in a litter box sample, which I'll be honest, sometimes makes me shake my head because I'm like, it's right there. You don't even have to go out in the yard, but nobody wants to go pick up poop and, put in a bag and drive in their car with it if they don't have to. Even I don't want to do that, and I don't have a problem with cat poop. So I can respect it to a point. But what do we need to be educating owners about when it comes to hookworms and roundworms? Because, these adult cats, we just maybe aren't seeing them as much. Maybe we're not testing as much, and maybe they're not quite as symptomatic as what we're seeing in the kittens.
Yeah, I feel like a broken record here with all of the things that are underappreciated in cats, but intestinal parasites, again, underappreciated, but not for any good reason, because they're actually quite common. So there are surveys showing 30% or more cats under 1 year of age, so those kittens that you're seeing, and 20% of cats over 1 year of age that present to a vet clinic have one or more intestinal parasites found on their fecal test. So that's a fifth of cats over the age of 1. Again, I think it's something that we're maybe not looking for, whether it's owner compliance bringing in a sample, us remembering to request a sample, all of the forgotten cat things that we do. But again, this is good enough reason for me as a clinician to prescribe a product that will treat the most common parasites each month, not just flea and tick protection. I'm not alone in this thought either. The Cassi and other experts will also reinforce the recommendation of protecting every cat every month all year long for intestinal parasites. And again, cat behaviors, something that we talk about so much in this conversation, they put them at risk for becoming infected with intestinal parasites too. We know that they have a love of hunting, which will expose them through their prey, so arthropods, small mammals, birds. But that grooming behavior, again, exposes them because they could be ingesting any soil with parasite eggs in it, whether that soil was gotten by them going directly outside or soil that you brought in on your shoes. So again, no cat is truly an indoor cat anymore. The outside finds its way in, and that means that these parasites and risks also find their way in.
Absolutely. I feel like we can't say that enough of even if your cat is totally inside, you are not totally inside for the most part.
Hopefully
And so
not.
there's absolutely things that we can bring in with us.
Yeah, the risk factors are there. It's just a matter of education and awareness, I think.
And I think we can all kind of agree that there's a lot to talk to pet owners about when it comes to wellness exams and keeping their cats healthy. And it can be hard to fit these conversations in a way that owners really retain what we're talking about and can take action with it when there's just a lot to cover. So what resources should we as veterinary professionals be considering in practice as we're talking to pet owners about this and educating them to where we can maybe help drive that message home a little bit more effectively?
Yeah, so I think one of the biggest resources is the veterinary professionals themselves through the entire clinic at every level. So one of my biggest recommendations is going to be to reconsider the content in your kitten appointments or your new cat appointments. We know a lot of cats are adopted as adults too. Making a more proactive approach to parasites. This means taking the time to do thorough education on all aspects of parasite risk in cats, heartworm disease, flea and tick, intestinal parasites, including the tapeworms. So using visuals and taking the time to explain risk factors, modes of transmission, so that they really understand that there is a risk to their specific cat. That might also mean doing some discovery as well, find out what that cat's lifestyle is or is going to be. Maybe it's a brand new cat and they're not sure. So give them some watch outs and some, hey, if this changes about your cat's lifestyle, let's go ahead and make sure that we then circle back and make sure we're covering for all of the risks that your cat is presented with. Even if you can't get a pet owner to commit to using a comprehensive product for protection every single month, the Cassi will still also recommend deworming them at least 4 times per year. So I think that's also a strong message to make sure that we weave into this education, is that deworming is not a one and done activity. Fleas and ticks are a year-round risk. Heartworm disease is an actual risk for our feline patients. And tapeworms, we're learning so much more about them with the newer diagnostics. Those risks seem to be higher than we ever thought. So just really sort of revamping that conversation and making it a priority right alongside our vaccine conversation and our nutrition conversations for any of these feline patients, whether it's a kitten, a newly adopted cat, or a cat that you just feel like you haven't had the full conversation with yet in your clinic.
Sure. And I love that you bring up the kitten appointment. For me, I feel like that's such a good time to be talking to pet owners about parasite protection because kittens, cats in general, they're very resilient animals. So rather than, well, you have a healthy kitten, here's how we're going to vaccinate, I'll see you in a few weeks. That's the perfect time to bring up the importance of making sure they're protected from parasites when you're not having to also talk about arthritis and dental disease and all of these other things. God willing, you have a healthy kitten you're looking at in front of you. But it's such a good time to really drive home that preventative care conversation.
Yeah, I definitely agree. I feel like kitten appointments are usually so quick and easy breezy, but I think if we could just add in a couple of extra minutes for parasite conversation and the recommendation for using protection monthly and comprehensive protection at that, I think that's really important. And I do think that in my experience, I feel like I could probably fit that into my traditional kitten appointments because, like you said, they are pretty straightforward most of the time because kittens tend to be pretty easy, healthy first visit.
Absolutely. Well, Dr. Coleman, it sounds like you and I share this passion for preventative care and really lean into that, an ounce of prevention type of philosophy. So I so appreciate you coming on with this Vet2Vet and explaining all of this for us today. Thank you so much.
Yeah, it's really been a pleasure. I hope that some of the statistics I shared can help educate out there and spread the education through the vet clinic and to those pet owners, just so that we can protect more cats. That's definitely the big goal here.
And thank you to Boehringer Ingelheim for partnering with us for this edition of Vet2Vet. Check out NABC's vetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day. NexGard Combo Esophoxylanar Aprinomectin and Praziquantel topical solution is for topical use only in cats. Safe for use in cats and kittens 8 weeks of age or older, weighing 1.8 pounds or more. Use with caution in cats with a history of seizures or neurologic disorders. The most frequently reported adverse reactions include vomiting, application site reactions, lethargy, and anorexia. If ingested, hypersalivation may occur. Avoid direct contact with application site until visibly dry. For the full prescribing information or for additional information, visit www.nextguardcomboclinic.com or call 888-637-4251. NexGard Combo Esophoxylanar Aprinomectin and Praziquantel topical solution is the first and only broad-spectrum parasiticide for felines that protects against fleas and ticks, prevents heartworm disease, and treats and controls roundworms, hookworms, and tapeworms. It is a first-of-its-kind formulation that includes esophoxylanar, specifically developed for use in cats. NexGard, Afoxylanar, is for use in dogs only. Safe for use in puppies 8 weeks of age or older, weighing 4 pounds or more. The most frequently reported adverse reactions include vomiting, pruritus, lethargy, diarrhea, and lack of appetite. The safe use of NexGard in pregnant, breeding, or lactating dogs has not been evaluated. Use with caution in dogs with a history of seizures or neurologic disorders. For more information, call 888-637-4251 or visit nextguardclinic.com.